Today we're going to talk about breathing for back pain relief. We're going to talk about some deep, slow breathing techniques that have been shown to have a real benefit to decreasing pain, stress, anxiety, depression, lower blood pressure, a lot of good things, and it's been around for thousands of years. At the end of the video, we will be showing you two very simple techniques you can do right away. Don't be overwhelmed by it. You're going to be able to do this very simply at home right after this video, but stay tuned to the end. But first, we're going to hear a little bit about the start to slow breathing or deep slow breathing. So deep, slow, or controlled breathing techniques have been around for thousands of years. We're Eastern culture, a lot to do with kind of in conjunction with meditation, relaxation, and really has been kind of like a hallmark of health benefits for them. And it's really been something that the Western world is really kind of looking at a little bit more and saying, I think there's something to embracing breathing. It's at the core, literally at the core of our center, and it really allows us to get in touch with kind of calming our system and kind of like a resetting. In fact, every time I show these exercises in the clinic, I feel so calm just demonstrating them. And over time, I feel like there's going to be a real difference in how you feel, especially during times of anxiety, nervousness, and things like that. It allows you to kind of do a good reset. So how does it work? So how does it work? So in the body, we have the autonomic nervous system, and it's made up of two halves that are kind of balanced, okay? Kind of balancing our body in the sense of, it's called the sympathetic and the parasympathetic, okay? Don't worry about the terms, but these two systems have to be in balance. Now, so what is the sympathetic for? Now, sympathetic, you'll commonly refer to as the fight or flight. Big lion just came after you. I'm sure this happens in the suburbs of New Jersey. Runs after you, and you start getting into that fight or flight reaction, and the sympathetic activity starts really heightening. We get tense, we lock down, we're trying to take action, we're escaping, we're trying to take decisive action, and we've got to be in a mode. We use our adrenaline. Everything is shunted to getting rid of this problem and taking action. Okay. The only problem is that when this system consistently keeps kicking in and almost doesn't turn off, there's a problem. So the parasympathetic system is more the more restive system. After Thanksgiving dinner, I heard someone talk about this. You're sitting down, you're relaxing. It's that calming. It's that feed and rest kind of system. And when that system isn't allowed to balance the sympathetic, we start running into trouble. It can cause inflammation. It can cause an increase in cytokines, various inflammatory factors that will actually rise. And that can be a source of pain for back pain, and also can be a source of any kind of musculoskeletal pain. It can heighten, or just inflammation in the body. That's been a big issue, is lowering general inflammation in our body, whether it be dietary ways of doing that, and stress reduction. So these breathing techniques are supposed to allow us to reset that system and allow that parasympathetic system that's really not active as much, and the sympathetic system that's in overdrive. It's churning, it's causing tension, it's causing headaches, it's causing us to lock down, getting spasms, it's getting it to relax, and we're trying to bring up the parasympathetic system. I started a little bit. Parasympathetic system and relax us. And the breathing techniques have been shown to help us kind of reset and bring that parasympathetic system up a little bit to get us to relax. Hey, it's great. Not a pill, not anything like that. It's a nice natural way, and you can do it anywhere. So an interesting finding they found is that individuals that are able to get their resting breathing rate to about 8 breaths per minute, that's part of that deep, slow breathing, really allowing that, we really take that deep breath. Actually, we're in a better state. They actually had much better balance in parasympathetic and sympathetic balance. They actually improved their parasympathetic tone, so they had less of a sympathetic dominance. They was kind of overriding. Those people that were around 12 to 16 breaths per minute, which is a lot, almost like that really quick, shallow breathing, or that nervousness where you feel like your heart's racing, that's that sympathetic taking over. So if we can work on kind of reducing that, getting our breaths down, we're nervous about that presentation, our back pain is bothering us, we're getting nervous that we can't do something. So we want to work on that deep, slow breathing, and our goal is somewhere between that, below 8 breaths per minute. It's a goal. But especially if you see like your system's revving up, that's 12 to 16 breaths per minute, we want to reduce that. And this has been shown to help reduce that. Some of these deep, deep, slow breathing techniques have been around for many, many years, but they didn't quite realize what they were doing, and that's what they think is going on to help people relax. And it decreases, like I said, some of those inflammatory factors, increased cortisol, cytokines, all those things kind of reduce a little bit, and hopefully have less pain. All right? So when we observe someone that's got a really healthy breathing pattern, they tend to have a very deep breath, okay? To take that breath in, you tend not to see as much rib expansion or using some of these muscles they call the accessory muscles to pull up like that. You'll see people, when they place their hands out, they tend to get much more breath lower, kind of belly breathing. The less attractive, your belly kind of comes out. And you also get that breath where you almost feel like the sides of your ribs are kind of expanding out. Nice and low, deep breath. They found that really allows the muscle, it's called the diaphragm within your chest here, and that allows the excursion, the diaphragm, to move enough, almost like a pump, okay? Enough of that change in position. When you get into those deeper positions, it allows that change in that pattern, that excursion, I'll call it, and that allows for more oxygen to get into our lungs and really expand our lungs and get that deep, and also slowing down our breath. So really good, healthy breathing actually, they feel is, and they're seeing, is that the diaphragm, which is deep to our trunk here and helps for creating a vacuum effect and bringing air into our lungs, has the max excursion, I mean the amount that the diaphragm moves up and down, assists in breathing. Okay, so when we have you see healthy individuals that have that lower, more of that 8 breaths per minute, they get a very low breath. In fact, you'll see people doing the breathing techniques, they won't have a lot of chest movement, like that. They'll actually have, and they won't use these accessory muscles in here to kind of elevate the rib cage. That's why you'll see certain people that have trouble with breathing, they'll have overdeveloped muscles here, sometimes smokers and things, where they're trying to get some more breath in because they're using these muscles. So we're trying to avoid that. So we want really more of a belly breathing, less attractive, but a little belly breathing. And you want to feel like the lateral, the sides, just like below your ribs, you're getting that expansion to the sides, that deep breath. So what's happening is we're getting maximal movement of that diaphragm, which allows more volume or more flow into the lungs. And that allows us to not take as many breaths because we're getting more oxygen into our system and we're slowly allowing it to enter our lungs and help us with oxygenation. So anyway, that is healthy breathing. Okay, so that's our goal. That's what we're going to look for in these techniques. So the first one we're going to talk about is was described by Andrew Weil, okay? And he describes the 4-7-8 method of breathing, okay? We're going to first sit up, make sure we're in a comfortable position. If you're having back pain, that's why we're trying to show you this. We want you in a position maybe supported. If you feel like, standing, like I'm sitting here, I don't have any back support, maybe a little back support, lumbar support. If you need to, you can even do it in standing, leaning against a wall, or lying down if you have to. Whatever it is, you should feel it's in the comfort position you can achieve while you're doing this exercise. If you're starting out really toned up, it'll be harder to get the same results. Okay? So the other thing you're going to do is you're going to place your hand on your chest and the other hand on your belly. You're going to breathe in through your nostrils here for a 4-second count. And try not to let the chest expand. We want all that down below here. And then you're going to hold that breath. Close your mouth. You're going to hold that breath for 7 seconds. If you can't hold it for 7, then do 3. But do whatever you're able to do without struggling, because we don't want you increasing that sympathetic tone. You're getting guarded because you're out of breath, okay? And then you're going to breathe out through your mouth, holding the tip of your tongue on the back of your front teeth like this. Some people and versions of this are to kind of tuck your abdominals in, kind of tuck your ribs in and to push the air out. Or you can just naturally let it flow out, okay? But that's the 4-7-8. So breathe in through your nose for 4 seconds, hold that breath for 7 seconds, and then slowly allow your breath to come out. Either just let it, just for up to 8 seconds before you start the 4-second inspiration again. Okay, before you start breathing in again through your nose. So 4-7-8. As you do it, put the tip of your tongue, as I described by Andrew Weil, in the back of your front teeth. And it helps you. If you feel like it's more calming, close your eyes. I think, keeping less music, less distractions initially, but eventually you should be able to do this anywhere to kind of reset, especially if you're in stressful situations, or if you're in pain. You may not be in the perfect situation to do this breath, but try it, okay? That's the first technique. So the second and the last technique is called square breathing. Square breathing or box breathing. And you'll hear about this. The Navy SEALs are actually instructed on using this technique to calm themselves down and relax. We're talking for back pain relief and to kind of reduce that sympathetic drive we talked about earlier that gets us locked up and actually can increase spasm or tension, okay? So called square or box breathing. So you want to visualize a square or box, okay? It's a 4-4-4-4 breathing technique. So the first one is, I'll just explain it first, is 4 seconds up where you're breathing in through your nose. Then you're holding that breath for 4 seconds across, and then you're releasing the breath, just like the other 4-7-8 technique. And then what I like about this one is you kind of just set and relax for 4 seconds. 1, 2, 3, 4. Count to yourself. You don't have to count out loud, but it should be very rhythmical and relaxing. Okay. We want to get that parasympathetic. We want to drop that cortisol, those cytokines. We want everything just to kind of relax and reset that system. And we probably have to do this a lot, okay, to really make a difference, especially early on when you're having a lot of pain. You can't just do it for a couple minutes and say it's all right, but kind of periodically do it throughout your day, especially when you see your back pain is increasing or your tension or stress is increasing, which doesn't normally help anyone that's got a back pain episode or chronic back pain. So let's do this together. So hand across our chest, hand on our belly. We want to breathe in for 4 seconds through our nose. We want to hold that breath. And you can see how my chest was coming out a little bit. I should get more into that belly. So let's reset that again. So breathe through our nose. Now we got a little bit more of that belly excursion out to the side like we were talking at the lateral side. Hold that breath for 4 seconds. Now slowly breathe out. They'll say through pursed lips. And feel like the oxygen is just rolling out of you. 1, 2, 3, 4. All the breath is out. Now relax. Best part. 1, 2, 3, 4. And then just think about you're just taking yourself through that square and that box all the way through. Hey, I hope this helped you out. Enjoy. Subscribe to the channel if you like it. Comment and like. And hope to see you next time on our next video.